burnout is a big factor because you can imagine, especially with sort of underserved populations, the work is hard. The issues that families kind of bring in and patients bring in and walk in the door with, and how we work very hard to support them with, it can be really draining emotionally, as well as, and again, kind of, there's the emotional component of that, as well as, how easy or hard has the system made it for staff to help the patients that they want to help.
Right.
The programmatic work is to try to make it, make the system easier to navigate, easier so that people can feel like they can stay vital in this work that's very, very difficult to do.
Right.
Yeah, and I think, I'm going to say the other piece that I think has been key to that is, kind of what we sometimes just call an improvement culture. That, when we talk to folks about gaps or deficits or barriers, it's not to point fingers or to, attribute blame. It's much more about, like, how can we do this better?
Right.
And so if we can kind of continue building that culture, that, I think that also helps to sort of inoculate or immunize ourselves against burnout. The stresses of work can ebb and flow, and so, with my allies and my supports, we kind of talk about this all the time. You're not allowed to have a stressful stressful time when I am, like, because we can support each other through it. But yeah, I mean, and then as again, senior team as well as managers, we work pretty hard to try to work against the burnout factor, because the work that we do is hard work.